public health crisis now in our country like nothing that we've ever seen before. This whole generation of kids is damaged by chronic disease. We are now the sickest country in the world.
Now, we've heard these talking points from Health and Human Services Secretary RFK Jr. time and time again, but for someone who says battling chronic disease in America is his top priority, he is about to oversee a huge potential slash to the budget of the agency he runs. Tonight, CNN obtaining internal documents revealing the White House's budget proposal for HHS. That proposal would slash funding for the agency by nearly a third, from about $120 billion to just $80 billion. And the things this proposal seeks to eliminate are pretty staggering. According to the memo, the CDC could lose about 40% of its funding, eliminating chronic disease prevention programs and domestic HIV/AIDS prevention. The National Institutes of Health would go from 27 research centers to 8. And a new administration for a healthy America would consolidate other agencies and fund new research for Make America Healthy Again initiatives like finding the cause of autism. Joining me now to break it all down, CNN medical analyst and professor of medicine and surgery at George Washington University, Dr. Jonathan Reiner. Really appreciate you being here. Look, all of what I mentioned is part of a proposal, I guess, at this point, so always subject to change. But what could some of the consequences of these spending cuts be on a practical level?
Well, first of all, this is potentially just a tragic, evisceration of the world's greatest medical research institute. And what makes it even more tragic is that it's a potentially self-inflicted wound. You can't cut that much money, almost 40% out of NIH, taking the NIH budget from $47 billion to $27 billion without basically just shelving dozens and dozens of programs. And when you do that, you lose these coveted researchers who will move to industry, they'll move to universities, some will move out of the country. NIH is one of the most coveted jobs in medical research in the world, and we are going to gut it. And what that's going to mean practically is innovation is going to drop, discoveries are going to drop. Hope for people with neglected diseases or diseases right now that don't have effective treatments will be lost. This is just a completely unnecessary, tragic potential move on the part of this administration. And the sad thing is that, although these numbers sound big, cutting the $40 billion in NIH, in the total HHS budget, that's like a drop in the ocean. And they're cutting these pivotal programs because the big dollars, almost $1.7 trillion in HHS, is untouchable in Medicare and Medicaid.
As part of this too, we're also earning grants for rural hospitals, and state offices of rural health will be eliminated under this proposal. Obviously, these are communities, in some cases, these are communities that voted overwhelmingly for Trump, but also they don't have the same access to care as big cities. When you look at the impact on rural communities especially, what differences do you see there as opposed to what someone might feel in a New York City or Los Angeles?
Right. So, in D.C. where I live, or New York City where I'm from, there are hospitals everywhere. There are dozens and dozens of hospitals. In rural communities, over the last couple of decades, we've seen basically a hollowing out of the healthcare infrastructure. And you need to drive a long way to find a hospital or a clinic in some parts of the United States. And these are parts of the country that have a lot of poor people who depend on access to these kinds of places that are heavily dependent on federal funds. And if you gut those funds, those hospitals and clinics will close, and people will go without care.
And that becomes the question, because there are in some communities where people are driving 30 minutes, an hour, sometimes even more for specific types of care just to get to a hospital that can assist. I also want to ask you about the CDC published a study yesterday showing the autism diagnosis rate for children rose to 1 in 31 in 2022. That's up from 1 in 36 in 2020. Now, the study points to better access to screening and identification services as one of the reasons for this increase. But today, Health Secretary RFK Jr. is really contradicting that finding, coming up with his own explanation. Just take a listen to what he said.
This is a preventable disease. We know it's an environmental exposure. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go out on a date. Many of them will never use a toilet unassisted.
Now, I just have to say, autism is a spectrum, and while there are some cases that people are more physically impaired than others, it's not a complete broad brush of the stroke. Just want to say that before I ask you, though. What is your reaction to sort of RFK Jr.'s posturing coming out of the CDC study?
Well, I have to say, there's never been a less qualified person to run a major department in the United States, ever. He is just totally unsuited for that job. And I would think that somebody who purports to care so much about autism and has spent so many years of his life trying to figure out why autism exists, that he would know more about the disease. And when he made that statement about never pay taxes, never hold a job, never play baseball, that offended millions of people in this country whose kids who live with autism spectrum disorders, he said a spectrum. So some of these kids, many of these kids, and now young people, live very productive lives, do pay taxes, do play baseball, do get married. And his apparent inability to understand the reality of this disease goes hand in hand with his inability to understand that vaccines do not cause autism. That is proven. Vaccines do not cause autism. But he is going to persevere until he presents to the United States public, data that validates his completely unproven, disproven notion about the origins of autism. The true origins are this is a complex problem, a lot of genetic components, perhaps some environmental triggers, but the seeds of autism are found in utero in the months before birth.
Dr. Reiner, really appreciate the time and perspective. Thanks for being here.
My pleasure, Anna.